Here's a medical thing they don't tell you. Cancer usually has 4 stages. Not all cancers are staged this way. Sometimes blood cancers don't go through the staging, but most solid cancers have these 4 stages. Stage 1 is usually a tumor that's small and it hasn't really spread into the lymph nodes. So that could be a small little spot in the lung, a small little spot in the breast, a small little spot in the colon, and so on. Generally, the treatment for that is something like surgery and not necessarily something more like chemotherapy. Stage 2 is when the tumor is slightly a little bit bigger and now it might involve the lymph nodes. The treatment for that, generally speaking, is also surgery, but now starts to include things like radiation after the surgery, as well as chemotherapy, or in some cases, targeted therapy or immunotherapy. Stage 3 is when the tumor has gotten significantly larger. It's likely invading into different structures. So if it's a tumor in the lung, maybe it's starting to invade areas near the heart tissue. It starts to invade the lymph node. Surgery here might still be possible for certain cancers, but again, becomes a little bit more technically difficult. So some doctors might not prefer to do surgery. Most of the time, chemotherapy is involved here, as well as maybe immunotherapy or targeted therapy when it can be involved. Stage 4, and this is the scariest, is when the cancer has spread to somewhere entirely different. So if it started in the lung and it spread to the brain, or if it started in the breast and it spread to the brain, or if it started in the colon and spread to the lung, that's stage 4. Usually speaking, with stage 4, you can no longer do surgery because it's just spread to so many different spots in the body. This is more of a disease that you treat with chemotherapy, immunotherapy, or targeted therapy.